And after that, like you, I'm looking forward to hearing the comments of the panelists and to a wider discussion. So, moving to my first slide, SEMA was created on the back of a very strong awareness in the community that our market ecosystem is fragile and it's imperfect. And of course, it's important to say that this is certainly an ecosystem that has delivered incredibly important results and continues to do so. That's not in doubt. Results in terms of product introduction, access, and health. But I think we also share a strong sense of risk, of often swimming against the tide, a sense that some of the key functions aren't in place, or that maybe a single decision by a manufacturer or by a donor can plunge the system or a part of the system into crisis. And of course, the stresses caused by COVID have also brought many of these weaknesses much more clearly to light and created many new problems. So SEMA was created to address this fundamental challenge of strengthening that ecosystem so that it delivers better now and critically can continue to do so into the future in what's a rapidly changing world. The SEMA vision and mission reflect that. You can see those on the slide. SEMA's vision is a world with healthy, equitable, and resilient markets that allow women and girls to control their health and future. The mission flows from that. It's to work with partners to deliver strategies that support those healthy markets at all levels. So in summary, we SEMA are here to work with existing partners, adding value to their work, and together work towards a market ecosystem that delivers and is sustainably financed, and of course, critically, is driven by the priorities of countries and consumers to a much, much greater extent. So in the next slide, I'm going to turn to how we propose to do that. This is our theory of change. The slide runs from left to right. You may have seen this before. It runs from inputs to outputs to outcomes. On the input side, SEMA works through 4 standard market shaping steps in partnership with others. Understanding markets, number 1, designing solutions, delivering those solutions to problems, and then tracking and improving through implementation. And what we aim to deliver with those inputs are healthy markets. What do we mean by healthy? We mean strong market foundations, things like data and analytical tools. You can see those in the boxes. And we also mean healthy in terms of the market conditions or performance that the market delivers. That's measured in terms of dimensions like supply or affordability. And again, you can see those in the semicircle. So that's the healthy. That's what we mean by the healthy part of healthy markets. But what do we actually mean by markets? So we understand the system, the ecosystem, to be made up of markets at different levels. National markets, individual product markets, and also the cross-cutting market enablers that support the product and national markets. And really the point I want to stress here is that for the ecosystem to deliver what we need, markets at all levels have to be healthy, and they have to be contributing positively to each other's performance. And so then, as a final step, of course, in the theory of change, on the right, we believe that through these interventions, we can contribute, do our part, markets can do their part to improved uptake and health outcomes. So going to the next slide, I wanted to say a little more about those different market levels. This slide intends to be a simplified snapshot of what we know is a very, very complex ecosystem. It shows the way in which different stakeholders, different actors in the boxes, perform different functions, managing the flow of funding, of products, and information to deliver access. And so, really what we hope this slide helps to achieve is actually capturing the overall purpose of SEMA in a way. We work to better understand the flows of funding, the flows of products, the flows of information between the different actors in the system, and we hope to help make that ecosystem fit for purpose over the next decade and beyond, underpinned by more sustainable financing and a much stronger role of countries and consumers. So just to talk a little bit through the slide to explain it, the upper part of the graphic shows the structure of product and national markets. The national markets run across the horizontal. They're made up of those blue boxes and also the purple ones. The national markets we know are critical. It's these markets that deliver to the last mile, ensuring that mix of methods, safe, effective, affordable mix is available where it's needed. But they can't function alone. To function well, national markets depend on well-functioning product markets as well. And so those are covered there in the red and also the purple where they overlap with national markets. And so product markets connect countries, country markets to international suppliers and buyers, and they ensure that the right products get to countries. So both, as we know, product and national markets are critical. And SEMA's thinking on those has actually been covered elsewhere at ICFP and other events. And so for today, what I want to focus on are these cross-cutting market enablers, which can be seen running along the bottom in a paler blue color. These are the sorts of market functions that are delivered by technical agencies, by global partnerships, NGOs, and others. Things like product introduction support functions or technical guidance, quality assurance systems, market shaping, and others. So that is what we're trying to achieve, strengthening this system. And as we move to the next slide, what I want to turn to is how might we go about identifying priorities and interventions. And to answer that, I'm going to run through some analysis that we've done, which builds on work undertaken by Dalberg Consulting over the last several months, which was actually presented at a SEMA webinar recently. And what that does is allow us to propose a set of solutions to strengthen market enablers. And so this slide summarizes the high-level findings of that analysis. And we use the SEMA Healthy Markets Framework, which is an assessment tool that we've developed. And so what you can see here, we've grouped the findings in terms of financing, product, and information. Why? Well, because for us, a successful market is one where financing, products, and information flow smoothly and effectively. So let me run through this slide, starting with financing at the top. Many of these findings are, of course, familiar. Donor funding, we know, is critical, but it's vulnerable. National budgets are growing, but not growing fast enough from their current base level to meet anticipated demand. The private sector is hugely important, but demand is fragmented. Moving down, we know that the state of financing has knock-on effects in terms of deterring supplier participation in some markets. That can lead to wide variation in price and quality across channels. We still have no internationally quality-assured products in Africa, and as the COVID experience showed us, that's an important dimension of supply security. And in spite of improvements, there are still shortcomings in the way product introduction and market shaping is done. And then finally, at the bottom on information, weaknesses on the data side, which we hear about a lot and talk about a lot, are widespread and undermine critical functions throughout the system. So, what would the ecosystem look like if the market enablers work better? And this is a vision of a better future state that's derived from the analysis and, of course, wider sources that's designed to describe that. So what I'm asking you to do is imagine a future state in which the center of gravity has shifted to the national level. Countries driving financing, procurement, and stewarding their own markets. And that would require financing to steadily transition towards the national level. It would mean a robust supply base supported by more efficient product introduction, market shaping, and demand forecasting architecture. It would mean our procurement tools are, effective procurement tools are available through all channels. And finally, it would mean a step change in data and availability. Now, the next slide, what we're trying to do here is bring together the vision that I just went through with our view of the ecosystem that I showed you earlier. And as you may know, SEMA is going to be proposing and thinking about interventions at all three market levels: country, product, as well as market enabler. And I'm not going to talk about the product and the country levels here. As I said, those are covered elsewhere. For today, I just want to draw your attention to this emerging agenda of solutions for market enablers set out at the bottom of the slide, and again grouped in terms of financing, product and information, stretching across the value chain to support product and national markets. Now, I won't go through these in turn. They're set out more clearly on this slide. And this is an emerging package of ideas. It's come out of discussions with partners. And what I want to say to you is really that working together across these solutions, a community of partners could dramatically transform the ecosystem for the better, make it fit for the future. I'm just going to highlight a few of these now. On the top row, for example, you can see the shift to more sustainable financing. That means increasing national financing. I'm talking about both public and private. Multiple partners are working to support this already, of course, and national governments, have we seen, including this week, are of course stepping up. We envisage SEMA's value proposition here as a policy broker, coordinator, as well as potentially providing capacity building support in our partner countries. And then as another example, I'm going to take you to the fourth row, procurement strategies, again, focusing on solutions that are most relevant to our topic today, procurement and financing. We believe that the non-donor market, by which I mean the market beyond the large global buyers like UNFPA and USAID, would benefit from strengthened mechanisms, procurement mechanisms. We've begun to explore the concept of an SRH specialist aggregator, and I'm going to say more about that in a moment. But finally on this slide, just at the bottom, right at the bottom, part of the critical information agenda, we believe that coordinated efforts to systematically capture and respond to consumer insights are also a priority, and we're pursuing ideas in that area. And so I'm moving towards the finish. I wanted to take the opportunity for a slightly deeper dive into a couple of concepts, the two that are marked in red, and those are solutions focused on financing and procurement. The first one at the top, potential partnership to support national government financing for SRH products, and the second is this aggregator concept that I mentioned. So first, turning to the first, this slide proposes that an SRH product partnership with the GFF, Global Financing Facility, could add energy to the growth of national government funding. So the graphic on the left, this is taken from the very recently published GFF annual report. It shows us that the GFF has been a powerful driver of countries committing more resources to RMNCH over the past decade. You have the GFF partner countries on the left and non-GFF countries on the right. So you can see the rise in allocation. This is a rise in the share of IDA, which is the concessional funding that countries receive from the World Bank. So the share allocated to RMNCH has risen over the past decade in partner countries. It's important here to note that there's been a big COVID impact, which actually led to declines in allocations to RMNCH in all countries in 2020 and 21. But the story and the reason that you still see a rise on the left-hand side there is that in the GFF countries, the increases pre-COVID were so large that the overall picture of a decade is of a rise. So what that means is that alongside the need to transition IDA-funded spending fully to government budgets over coming years, there also needs to be support for a bounce back from COVID, and that's part of the challenge too. So the proposition with this partnership is that an SRH focused effort jointly with the GFF could help in the challenge of ensuring that sexual reproductive health, including family planning, are properly included in national RMNCH policy and programming. And so this partnership would allow the GFF to provide additional support in areas like quantification, like forecasting, system design, monitoring, using its well-established relationships, tools, and approaches. So that's one partnership to focus on. And then I just want to, with a final slide, spend a few minutes on the aggregator concept that I mentioned. As I said previously, we believe that a strengthening of procurement tools and strategies outside of the donor-funded global buyer market could bring significant benefits in terms of availability, price, and quality. Now, of course, we know that private markets in many environments are working well and don't require intensive market-shaping interventions. You could think of many large country markets or markets for fast-moving, cheaper methods. But I think it's also the case that there are gaps in market coverage, particularly when private markets are less commercially viable. The more you look, the more you find missing sub-markets within the wider market that are less commercially viable, smaller countries, lesser used, more complex products. And so this proposal aims, first of all, to target those gaps in a purposeful way through an aggregator that could bundle supply and demand and put markets and transactions together in a way that doesn't currently happen where they're not viable. And then kick off a virtuous cycle of better customer service, availability, and access. And so just to talk you through the slide, this cycle could start with the identification of a mechanism or partnership that could bundle in this way. That's the entry point, the rectangle there in the graphic. So the greater the volumes, the greater the ability to provide reliable, affordable choice of products. And going around the circle, the more the volumes grow, the better the information on demand that can be provided to manufacturers. Better performance could also unlock more financing, and larger volumes could then perhaps justify greater investment in warehousing and higher stock levels, in turn further improving service. And so as more buyers and sellers were attracted to the platform, the virtuous cycle would continue to grow. And we believe that this process and impact of the intervention could also be accelerated with the addition of more service offerings. We could think about financing to allow for extended payment terms to buyers, for example. And that potentially could be something that particularly important in attracting public sector buyers. And we know that that's an important priority too. So finally, we could imagine partnerships with growing regional platforms and initiatives could be deepened over time to develop impact. So with that, Martin, I'm going to draw myself to a close. I just thank everyone for listening and hugely appreciate your attention and hope that you've heard some interesting ideas. And yeah, this time, Martin, I mean it. Over to you.
Undoubtedly. Thank you so much, James. Excellent, excellent. So without being able to summarize a fantastically rich presentation you gave there, James, just 4 quick points that jumped out at me. Firstly, that those healthy markets at all levels contributing positively to each other's performance. For me, that was takeaway number 1. A second, around the future state really being the movement of this center of gravity to the national level. You also spoke about the importance of a community of partners working together, and those couple of potential solutions that you highlighted at the end were all about partnership around stimulating increased domestic resources for SRH product financing, as well as this potential co-design of this virtuous circle created by an aggregator concept that has procurement and delivery capabilities. So thank you so much, James. And so there is much to discuss, and it's great that we now will bring our panelists in to discuss James's presentation from their unique and very important perspectives. And so, Dr. Salma, is it okay if I might turn to you first? And I've got a two-part question for you, which is this. So from your perspective, what are the key challenges that Nigeria faces, both locally and when working with the global community? That's part one. And part two is this. So what do you think are some of the homegrown solutions that have been successful to address the aforementioned challenges? Over to you, Dr. Salma. Thank you so much. And the microphone should be on, I hope. But it's not, so I'm going to give you mine, and we're going to keep going.
Thank you. Thank you, Martins, for that. And thanks, James, for the presentation. It's quite enriching. So before I go to the challenges, let me briefly mention that the federal government of Nigeria is committed to the scale-up of delivery of family planning services and commodities to Nigerians, those that are in great needs, women, children, adolescents, and men. So that commitment remains and is an integral part of our journey to attainment of the universal healthcare coverage, and is an integral part of our national development. Of course, the journey has not been so easy. We have had a lot of challenges, but of course, the most important thing is we are ready to address those challenges. Since 2011, the federal government committed to procurement of free family planning commodities and went into an agreement with global partners, which is anchored by the UNFPA, and we started contributing to the basket funding on a yearly basis. That funding has been maintained up till date, even though we have not been meeting to the commitment as it is. We're supposed to commit, we're supposed to commit about $4 million, but we had challenges. So the major challenge is on the financing, the contribution to the basket funding. And the government, if you look at the previous years, the track has been on, though we have not been meeting up to that commitment, and then we've even renewed the new commitment. However, because of the economic crisis globally, which has affected everyone, not only Nigeria, that has really been a setback, especially by the COVID-19. Our revenue, of course, is not a new news. It's a news on the line. We have seen that we have a lot of shortfall in revenue. And at the subnational level, Nigeria operates a national and subnational level. The subnational level are yet to also key fully into the contributions to the national funding for financing family planning and other delivery of family planning commodities in Nigeria. Other challenges, of course, we are still struggling to get the private sectors get involved and key into it, and a lot of business cases going on and dialogue with the private sectors to see that they are into it. But most importantly also, we have to balance between the demand and also the supply side of it. So there are challenges, of course, on the demand side of it. And the environment of the demand side of it is greatly influenced by communities, traditional institutions, and religious institutions. So a lot of effort, that has been a challenge also. Even if policymakers agree to key into it, it has to be influenced again by the community leaders because they control the parliament, who are the key that unlocks the potential to dedicate resources and ensures that resources are fully dedicated. So going outside that, other challenges that have confronted, of course, is about the data, generation of quality, real-time data generated from the subnational level, from the grassroots level, to key into the national level, which will help us in using that data to make timely decisions with respect to the needs that are required in terms of the supplies for that, and also giving adequate information to women, girls, and adolescents in terms of methods available. So we don't have variety and adequate method mix of family planning commodities in the country. So the information also given to the clients are grossly inadequate so that to help them make a decision of their own, and also information in terms of the side effects if it happens, and then where do they go to address such the side effects. These are also some challenges that the country is facing. So there are quite a number of challenges if I have to go through, I think. So it's not to come here and just continue to lament on our challenges. But one that I would like to end up with is that we don't have control, and I'm happy I heard from this presentation, we don't have control of the global markets. Nigeria does not own and lead on the marketing. What we get, how do we control the pricing, how do we get out of it also and deal directly? So that control, we don't have that power, and that is another limitation that we are facing. So let me quickly come to the other side of it in terms of solutions. I think the power is the ability to be able to address the challenges. And I'm happy we call it the homegrown solutions. So with the lessons we have just passed through recently through the COVID pandemic, a majority of our funders, especially a major funder, which is FCDO, we had a cut in funding for family planning commodities, and that has grossly affected. And also the government contribution to the basket funding also had a lot of challenges. So what we felt was to look inward and then identify what will be our way forward in terms of generating domestic financing that will secure and guarantee sustainable financing for family planning commodities and delivery that can stand the test of time. In an event that we have such a similar situation in the future, we are not praying it happens, but we have to safeguard that. So the first thing we did was to aggressively work towards resource mobilization in-house. We have what the government called the Basic Healthcare Fund, which is a 1% contribution of the Consolidated Revenue Fund of the whole government funding. So that 1% goes to what we call the basic healthcare funding. And within the basic healthcare funding, which is supposed to support all states, we've also positioned an integrated family planning, commodities and service deliveries from that. And states are asked to prioritize and ensure that happens. And at the national level, of course, we did reposition family planning, as I said earlier, to be an integral part of the universal healthcare coverage within that journey, because we cannot achieve UHC without family planning services. So UHC is part of it, and we begin a strong partnership with the National Primary Healthcare Development Agency within the whole process, right from procurement, distribution, service, delivery, and the commodity logistics management, up to the PHC level. And that is a commitment that we have taken at this moment. Recently, the President launched the National Population Policy on Sustainable Development. And he made it very clear that fertility control is key that will take us to national development. So we are not currently seeing family planning as just a health issue. Family planning is now a key to national development, and it is integrated within all national development plans in the country. So these are some of the steps we have taken. Recently also, we have committed to the FP 2030, and within that commitment, we did it differently in terms of reaching that level of commitment, because state level were involved, civil society were involved, young people were involved in development, private sectors were involved. And what we did was to ensure that sub-national level, that is the 36 states of the Federation plus the FCT, commit also 1% of their health budget to family planning commodities. And this is enshrined within that our FP 2030 commitment. Then private sectors, Nigeria have learned with the coming of the COVID in 2020 till date that the private sectors in Nigeria can contribute greatly, and they did contribute greatly through their platform, which they call the COCAVID. And also lessons have been learned from the HIV/AIDS Private Sector Alliance, and currently we are leveraging all those opportunities and lessons learned to see how it can bear on family planning delivery in the country. So we started engagement with private sectors. Committees have been inaugurated by the Honorable Minister of Health. We've also developed guidelines on how we can leverage opportunities, but there's so much to be done so that private sector would truly buy into it, also to see what markets exist for them in the country. Yep. So just to put the final one that I think it's worth mentioning, it's about the data, the data and information. We're very happy that Nigeria is part of the global Visibility Analytics Network, and we're really benefiting from it. And we're seeing the future for that is that it should be decentralized up to the subnational level so that it key into our warehouses, not only at the national level, but also at the subnational level, and capacities to be developed. So it will help giving us real-time information and data, tracking our progress and seeing where the challenges it and enable us to take a quick action. So these are areas, some of the modest progress we have made in the country. Thank you.
Thank you very much, Salma. That's great. And I really enjoyed the way that you spoke, and you really did link the sort of the virtuous way in which different parts of the market, community support, the state level, the national level, the global picture could work very well together. In Nigeria, 1% can be a very big number, and the basic healthcare fund, that allocation, and then the 1% of state budgets that's within the FP 2030 commitment for FP is very exciting indeed. So thanks so much for setting out those homegrown solutions. And so, Ayman, I come to you next, if that's okay, and I'd love to hear from you, in your opinion, what commodity financing challenges that James articulated in his presentation really resonated with you, and linked to that, how UNFPA Supplies is addressing these. So over to you, Ayman. Thank you.
Thank you, Martin. And first of all, thank you very much to you and to our colleagues at SEMA for inviting me to this panel discussion. So I would like to start with what James started in his presentation, speaking about the market fragility. And if we try together to come up with a mental snapshot of what's the situation like right now, we have turned 8 billion people. Almost 250 million of these 8 billion are sexually active women in reproductive age who do not want to get pregnant, but yet are not using a method. If we dissect this a little bit deeper, we'll find that most of these women are in either lower income countries or low mid-income countries. If we dissect even further, we will find that most of these women in LICs and LMICs are mostly living in either rural remote areas or areas that have been a victim to conflict, geopolitical conflict, climate changes, and all of that. So to get back to what James has been mentioning, we have a big problem with regards to market fragility, especially with regards to sustaining equitable access to modern contraception. So what is it that we have right now? We have a system that is almost entirely donor dependent on financing for commodities. I'll give you a very simple modeling example that in order for us, the global community, to achieve a total response to unmet need in family planning by 2030, to achieve the SDGs, we need around 70 billion US dollars, 69.9 billion US dollars. Out of these, we only have 8.6 billion committed from the donor countries. The 59.9 gap is to be either covered by the governments or they are going to be out of pocket paid. So this is a major problem that we are having right now with regards to financing for contraceptives. Family planning and access to contraception is not streamlined within UHC yet. So many of those who cannot afford to pay have to pay for these commodities. There are many policies that regulate the pricing and the distribution of modern contraceptives are lacking in many of the countries that we served. So the fragility of the market, using what James has mentioned, and the lack of equitable access to contraceptives, I think, is the two main highlights. So at UNFPA, what have we started doing? UNFPA, as I'm sure everybody knows, is the UN Agency for Sexual and Reproductive Health. We are considered to be the biggest providers of donated contraceptives and maternal health medicines to the developing world. This is the short-term solution to provide the contraceptives, but we have started adopting long-term solutions by working closely with governments. And as Dr. Salma has been mentioning, we are starting to work with governments to look into the policies that regulate the financing of contraceptives, the procurement of contraceptives, and improving the distribution and supply chains of these contraceptives. So first and foremost, we have started establishing a relationship that is built on mutual accountability. So it's not a donor-driven provision of donated contraceptives for free. There's mutual accountability. The governments are accountable to allocate from their own budgets. The governments are even contributing to the price of the commodities that we procure, and the governments are committed to establish an evidence-based quantification process. As Dr. Salma has mentioned, we use now the joint platform, which is the Global VAN, the Global Visibility and Analytics Network, as our data source to contribute. So this is what we've been working with the governments on. Also, UNFPA has revised its mandate with regards to the procurement of commodities. Till the end of 2021, our procurement services branch was responsible of the provision, the procurement and the delivery of commodities to the port of entry of the country. Our mandate has changed since the beginning of this year. We have now a supply chain management unit that is mandated to ensure that commodities make it from the end to the end. We have a very robust now last mile assurance process that we use to make sure that the commodities are delivered to the end user, which responds to the issue of equitable access to contraceptives. So these are some of the interventions that UNFPA is doing right now. We are working very closely with our colleagues from the SEMA and from Reproductive Health Supplies Coalition to ensure that we come up with these sustainable solutions to improve the market over the coming few years so we can contribute to reducing this unmet need.
Thanks, thanks so much, Ayman. So really appreciate you. Yeah, the round of applause for Ayman. Thank you. And I really appreciate you talking about the key issues of fragility and equitable access, then setting out the way that in partnership with government, there's that mutual accountability which will evolve over time, I think involving co-financing within UNFPA supplies, the important area of quantification and the GVAN that you set out, as well as the evolution as well of the procurement services branch into a through supply chain management unit. So really appreciate those insights, Ayman. Excellent stuff. So Lauren, let's change tack a little bit. And you've got some unique insights for us, I know. So would love to hear from you on the key challenges that you feel are there in terms of the work in the private sector and your significant role in scaling up family planning commodities. Over to you, Lauren.
Thank you. And thanks again to Martin and James and the broader SEMA and RHSC teams who have put this together today. And I know we're taking forward this discussion beyond this panel today as well. Before I jump into the challenges, I just want to set the stage briefly on private sector contribution already. The private sector is a leading contributor to financing and procurement of family planning commodities globally, and to a larger extent for safe abortion commodities and technologies as well. Private sector at the country level also plays a significant role in terms of provision of services and commodities. In countries like Kenya and Uganda, over 40% of women seek a contraceptive method in the private sector. And that number is often greater in other countries as well. And even greater when you consider short-acting methods, commodities like oral contraceptives, emergency contraception, condoms, where the private sector often is the leading force in many countries in terms of commodity procurement and distribution in countries. The private sector is also particularly good at commodity procurement and logistics. There are sales and revenue at stake, and the most expensive commodity for a private sector actor is the one that's out of stock and not able to be sold or distributed. So I think, taking all of that together, I think the private sector can and certainly will play a collaborative role in looking at these solutions in terms of some of the efficiencies and equities that need to come into the system moving forward, and is well positioned to support governments and donor agencies in those areas. Not to say there aren't challenges, of course, and we want private sector to continue to scale up its contribution. I'll highlight two key challenges. Market distortions and inefficiencies still exist in many countries, and really creates a scenario of crowding out private sector in some cases. There are policies or systems or sometimes practices or informal practices that often lead to public sector commodities being widely available in private sector outlets. And some of those policies and practices were put in place over the last few decades with very good intentions and very successful intentions in terms of trying to make commodities and family planning services available beyond government facilities. And that's certainly contributed to increasing access to family planning, increasing contraceptive prevalence rate, and reducing unmet need. However, I think there's a shift. So those systems were likely also put in place in a time when there was not a robust private sector, and there were not as many social marketing organizations or commercial actors who had the ability to invest in the family planning sector in many countries. And so I think it's probably time to take a look again at a country level and see where it's possible to start shifting some of that responsibility to the private sector, which it would be happy to take up, and to create that space for the private sector to do so. At the same time, sorting out those distortions and inefficiencies will reduce the burden on public sector financing significantly. So that's one area. The other area is the broader context that private sector works in many countries. It's not always easy. There's often a lot of barriers to entry. There's a lot of regulatory restrictions and hurdles. Registration processes can be long and cumbersome, even for molecules or manufacturers that are well established and have been operating in the space for some time. Taxes and tariffs on imports can be quite high and increase the cost of business, but also increase the cost to the consumer significantly at the end of the day as well. Restrictions on advertising, demand generation, talking about contraception in a way that will create demand. And I thank Dr. Salma for mentioning demand, because I think you can consider that an enabling factor in terms of private sector as well. The private sector will be always looking for opportunities and ways to meet that demand. And so increased demand for products and services will always be something that attracts the private sector. More consumers into the markets, more marketplace, more market share, et cetera. So I'll leave it at that and look forward to talking.
Thank you, Laura, and thanks so much. Thanks for reminding us about the critically important role that the private sector is playing in the family planning sector broadly, and that role has only been increasing. Thanks for setting out the important review that seems to be necessary in many countries, that the thinking of yesterday and today with regard to the perhaps more limited view of the private sector needs to be reviewed in terms of its potential. Thanks also for bringing us to some of these very important points around barriers to entry and regulation and taxes, and the importance of investing in the demand side, that are all part and parcel of a healthy market and a healthy private sector playing its role. So I think we're doing okay for time, but I've got a second round of questions that we're going to move quite briskly through, team, if that's okay. So let's just then turn to those solutions that James set out in his presentation. And I'd love to hear from each of you which aspect of the solutions that James presented, that SEMA Reproductive Health is setting out, has the greatest potential for impact. And it's a singular answer that I'm asking you for. So which of those solutions do you think has potential for the greatest impact? And I'm looking for a signal from one of you as to who would like to go first. And don't all put your hands up at once. Then Dr. Salma, I'm going to go to you first, if that's okay. And I think the mic's just to your right. Which of those solutions greatest potential for impact in your opinion?
All right, great. Thank you, Martin. I think we have wishes. So our wish from what was presented is to see that Nigeria is positioned in a way that it can lead, it can participate in the discussions at the global level in terms of the marketing dynamics, the pricing, and also looking at enabling us and building capacities to look at also consumer perspectives. Because we don't know what they are saying at the moment. We're just giving them what we feel we should give them. So this will be our wishes, really, to see how we can cross that barrier and guarantee the market also back home, that the market exists, the demand aspect of it, it's there, and private sectors will be attracted to invest. And on the other side also, what we're going to ask our donors is just like you have a little baby who start walking the milestone, and then you nurse the baby to the level of having the strength. So Nigeria is committed, and we want our donors to continue to invest in supporting us to sustain family planning in the country, despite the fact that we are making our efforts and we are making a lot of assumptions. There are risks also, and our assumptions is that our economy will bounce back, hopefully, and the commitment will be realized, and we will have such an enabling environment where our community leaders, our religious leaders will fully buy into it. So this are our wishes.
Great.
Thank you.
Great. Thanks for setting out the importance of those market insights and consumer insights. Thank you so much, Salma. Lauren, I'm going to come to you next, if that's okay. So which solution really jumped out to you?
I'm going to go with solution number one, the increased national financing, with a few caveats. I think anytime we can put and give more power to governments to make those decisions and to meet the needs of their consumers, and to bring that decision making closer to the consumer, there's really not much harm in that. It will allow governments to be more responsive to the consumers, to the women who are going to public sector facilities, and more responsive if there are shocks in the marketplace or in the country. I think taking some of those levels out, ensuring that decision making can be rapid and agile, certainly will support response, and being able to meet demand where it is. I think the caveat on that is going back to my comment on the market distortions and taking a look at if this financing is increasing or shifting or changing, what is truly needed in terms of the financing. Looking at some of those inefficiencies that exist that could be resolved and figuring out the true level, or truly what needs to be procured with that financing. Making sure we have the correct products, the correct volumes, making sure that's not going to crowd out private sector. Things like having data, having that data to see where women are going, what products they're using, and which channels, considering cost of commodities. Implants are an expensive commodity. It might be something that's a bit challenging for private sector to invest in, both from a distributor and importer, but also for a provider to pass the true cost of an implant on to a consumer. So that's, a commodity that is already largely public sector driven, and where public sector potentially could focus and, leave some space for private sector as well. So I think in general, getting the decision making localized, country responsive, getting the money in their hands, so to say, and being able to be agile, but also keeping in mind of making sure we're not just putting more money into the system without fixing some of the parts of the system.
Thanks, Lauren. That locus of control very much being at the country level, those precious resources, the decisions around them being absolutely in the right direction. So, Ayman, I'm going to come to you in 10 seconds, but I'm just going to then encourage our audience to start moving towards a couple of the microphone posts over here and over here. These lights are very bright. Please move to those microphones in the coming seconds as you listen to Ayman's wisdom, because we're going to be coming to you for some questions for our panelists. So having built you up, Ayman, which of James's solutions really jumped out to you?
Thank you, Martin. I'm with Lauren about the solution of domestic financing and domestic resource mobilization for the procurement of commodities. And I have to say that we donors, we have been providing these donated commodities for so long, and any government official, when they receive these donated commodities, will naturally deprioritize and will look into other essential health services. So I think we owe the governments to work with them to help them analyze what exactly is needed, how we can mobilize those domestic resources, how we can improve the effectiveness of spending on the procurement of commodities. Again, as James mentioned, the solution of local procurement, improving local procurement, and improving local manufacturers' market. So we also need to work very closely with southern providers, southern manufacturers who are providing contraceptives, but who do not have the investment to be qualified or to be certified by the WHO qualification system. So we need to, for us to be able to help countries improve their national procurement, we need also to work with the private sector, with the private manufacturers in the global south to improve their quality assurance mechanisms so they qualify they qualify for the assurance mechanism by WHO, so they become part of the global market. So this is the other thing I think we need to do. We also, I feel that by working closely in identifying the policies that regulate the procurement of commodities and the distribution of commodities, and as Lauren said, establishing a clear role of the private sector and a clearly defined relationship between the role of the private sector versus the public sector, I think this is a very important solution. The last thing, and I don't want to belabor on this, at UNFPA, one of the interventions that we have done to improve this local procurement, we are availing our competitive prices now for the governments that do not have the upfront cash to procure commodities. So we have what we call the third-party procurement system that enables these governments to use our competitive prices, to use our procurement mechanisms to procure their commodities, which we provide them with quality assured commodities at very competitive prices, and we can actually help them expedite the procurement process so they can allocate from their resources.
Thanks so much, Ayman. So 3 key points there, the development of domestic procurement capacities linking to UNFPA's third-party procurement, the importance of a movement towards local manufacturing as part of this, and then the quality assurance that's important. That relates to Salma's point around making sure that countries like Nigeria really feel that they have a stake and a say in what's operating at the global level. And these lights are so bright, I'm not sure I can see anyone having moved to the microphones yet. So I'm actually going to look for people's hands, questions that you want to ask, and then I'm going to move you towards, to my right, I have please move towards the microphone that is sort of back behind you, sir. And I'm going to get your question in 1 second. The microphone is, if you look over your left shoulder, you can see it back there. Do you see the microphone, sir? Yep. I'm going to ask you to move over and use that microphone. And I'm going to ask people on the left-hand side to do the same. And yeah, I think we're going to have our first question. And others, please do not be shy. Sir.
Hello?
Yeah, we can hear you.
I'm on this other side. Yes. So I have a question. And,
okay. You're in the spotlight.
Yes.
I love it.
I
love it. Very good.
Yes, so I have a question. Thank you very much. It's been a really nice presentation. And it's to all of you, actually, but more to Eamon and the UNFPA team. My name is Griffins from Kenya. What are some of the things that the UNFPA and other global organizations have in mind to incentivize governments to set up funds and to basically optimize domestic funding for family planning? I know you've talked about a number of interventions to help them purchase, including getting FP commodities at a lower price, but I think there's also need to specifically either incentivize or provide a push for governments to allocate resources for increased domestic funding. So what are your thoughts on something like this?
Thanks, Griffins. That's great. And we're actually going to get our second question. I don't know if the spotlight's going to pick you out over there, but we'll take 2 or 3 questions in an opening group. Over to you. Please.
It's not working.
It's working. It is working,
oh.
Yeah. And you're in the spotlight.
Jacques-Antoine from Women Care, DKT Women Care. I have a question to you, Ayman. At the time we look at the news every day, we are speaking about global warming, overconsumption, war in Ukraine, for example, where billions and billions are given. And you told us that on your side you need 60 billions and you get only 8. So how can we make sure that overconsumption and global warming is not offsetting this need in family planning, contraception, access to the abortion, safe abortion, in order to make sure that we are not offset and we can make sure that tomorrow this is making the headlines in the news.
Thanks. Thanks very much, Jacques-Antoine. And I'm looking to see if there are other questions out there. The spotlight's trying to pick you out. So we're going to go with those 2 to start with. And I think the first question Griffin's asked, Ayman, very much to you. The second one, I think, Jacques-Antoine, was for you, Ayman, but I do believe Lauren and Salma will have reflections there on keeping the important investments that need to be made in the spotlight, given other competing spending priorities. But can you take Griffin's question first, please, Ayman? Thank you.
Sure. Thank you, Griffin. I think that's a very good question, and you are coming from Kenya, and it's also very important to say that many countries, I would take Kenya as an example, when Dr. Salma spoke about Nigeria, they have been doing extensive strides in improving healthcare coverage and contraceptive coverage in their country. I would start by saying that Kenya, for example, its devolved system allowed an improved financing for contraceptives. I'm not saying that they do not have a gap in their funding, which is still existed, but again, they have been adopting very good policies that are contributing to the autonomy of their districts, which I think is something that needs to be learned. So with regards to the incentives, I think number one, our honest and mutual and relationship that is built on mutual accountability with the government is very important, where we do not only focus on short-term solutions, we focus on an integrated human rights-based system strengthening approach. That is number one. It is not just about providing the resources for tomorrow, it's about how to build a robust health system that ensures the integrated delivery of healthcare, including sexual and reproductive health. We have been using some interventions that we can consider incentives, but again, I would put it in parentheses because mature governments, like the government of Kenya, the government of Nigeria, these are very well-established governments that have the intent and the wherewithal to improve their funding, the financing on family planning. They need the data, they need the quantification process, they need the systems. This is where we come up with. But as an example, to answer Griffin, we've established the match fund mechanism, where we have set aside funding to incentivize governments increase their financing for contraceptives. And when they do this, when they actually spend, not just allocate, when they spend on contraceptives, we match this amount of spending by an equivalent or a double amount of contraceptives that we provide for the country to cover for the gaps. So this is one of our incentives that we have been adopting. We are also working on multiple levels of domestic resource mobilizations, which we believe that will strengthen the system to allocate more domestic resources for the contraceptive procurement.
Thanks so much, Ayman. And Salma, I'm going to bring you to Jacques-Antoine's question, which is, given the magnitude of what needs to be invested to meet that unmet need that Ayman set out, how do we make sure in the conversation in Nigeria, for example, that is understood in the context of competing priorities around climate change, security, and so forth? How is that case being made and made effectively in Nigeria?
Yeah, the discussions is on, and as I said earlier, it's part of the holistic approach to sustainable development. As we all know, security is a challenge currently in Nigeria, as well as climatic change. But of course, security in terms of terrorism, and the sector that is most affected is the health sector. And within the health sector also is the RAMCA, reproductive health, maternal newborn, including immunization services. So what we have done around that is that we build a partnership, and it becomes everybody's responsibility. The partnership was launched across RAMCA plus N about 2.5 years by the Honorable Minister, and it's beyond just the health sector and players within the health sector space. It includes relevant government ministries like Ministry of Finance to invest, the Parliament, other ministries like Environment and Climate Change, the Ministry of Women Affairs and Orientation, and even the Defense Ministry, because it's a security issue. And then outside that, we have all the development partners, the implementing partners, the civil societies, the religious group and community. In fact, the community leader is the champion of that. So we are looking at it now beyond women and children's issue, but it is a development issue that every sector needs to contribute into it. And this partnership, it's ongoing at the moment, and part of it is to establish a trust fund. We've done that for HIV. We currently have a trust fund for HIV so that it will sustain itself over time. And also, we've also experienced that recently with malaria. So we are working towards having that. And the private sector, I didn't mention, they are also part of this partnership. So the thinking, I think, is along with what Ayman has said, and this is the way we are looking at it. And family planning delivery, we are not doing it as a standalone in isolation because it will not work. We've done that in the past, but we are working within the integrated reproductive, maternal, newborn, and child health, including care of the elderly and nutrition. So this is the package that we are considering, and this is the way we are going in Nigeria.
Thanks so much. Oh, Dr. Salma, that's excellent. And I'm looking for other questions. So please do get to the mic and find yourself in the spotlight. And as you move for those, I see there's one there, but I'm just going to come quickly to Lauren. And I think that is that Dr. Ejike Oji that I think I recognize you, sir. But Lauren, any reflections that you have on Jacques-Antoine's question and this, making the case for the importance of investing in the private sector's role in sexual and reproductive health commodities, given the significant array of competing priorities?
Yeah, I mean, in a sense, I'll go back to, one of my opening statements of, the private sector is ready to be there as a collaborator, right? And is particularly well placed to meet that demand, should it be there. In terms of financing, surely, I think, we've come through probably the greatest shock of the system the last few years with COVID that hopefully we will experience in most of our lifetimes. I think, there's always, unfortunately, going to be likely conflicts, economic shocks that the world is dealing with, and it does come down some at a local level and governments to be keeping, keeping the focus on family planning, keeping a focus on kind of that end game of working towards increased financing for it, and certainly leveraging the private sector again in terms of the contribution that increasingly the private sector is able to make in the coming decade.
Thanks very much, Lauren. So, Dr. Oji, your question, please.
Yeah, thank you, Martin. Thanks for all the presenters. My question, I don't know who to direct to, but I think to everybody here. Looking at what happened during the pandemic, we looked at equity, vaccine equity, and even the testing equity. It comes down to what's going on in family planning in Africa. How can the world help Africa to be self-sustaining in manufacturing the commodities or should I say, whatever that is used in family planning within the African continent? I think the lead presenter did mention what happened during the COVID-19 pandemic. There was a shortage in stockhouse of commodities in Africa, and it affected reproductive health services, especially family planning services uptake. So why is it that Africa cannot be helped so that we manufacture within the continent? That will lead to two things. It will increase jobs, and then also it will make sure that if there are disruptions based on any other thing, Africa will still not suffer. And finally, in terms of funding support, there's so much talk that is made about Africa being supported so much. But look at what's happening in Ukraine right now. The amount of resources that had gone to Ukraine to support the war efforts, if you compare the amount of resources that are sent into Africa to do some of these things, it's maybe a zillionth of it. So it's still the inequity that's going on around the world. So my question would be, how do we support Africa to be self-sustaining?
Thank you so much, Dr. Oji. And I'll come to you first, Ayman, because Dr. Oji raises the point about local manufacturing that you picked up in the answer to, I think, my second question. And what sort of time frames are we looking at? What strides are being made? How's UNFPA working in this area? Can I come to you?
Sure. Well, I would like to start. I mean, the first question is really touching upon a very important thing. And if I may just provide my subjective reaction, Africa does not need to be helped. Africa needs to be recognized. African local production is existent. African local markets are existent. And African demand for African products is existent. I go back to James' presentation about the fragility of the African market and the lack of equity to accessing the African market. So to answer to your question, sir, I think what we need to do now is to support African markets in terms of production, in terms of supply chains, in terms of distribution, in terms of demand generation, and in terms of the private sector that can enable these African resources to be mobilized. This is what we need to invest on. It is not helping Africa. It's as if, maybe I'm a little bit emotional here. Africa is not handicapped to be helped. Africa is very solid, but we need to make sure that its potential is realized. So this is what I think we need to do.
Thanks so much, Ayman. And very well said, very well said. And a good provocative question from you, Dr. Oji. And I'm going to come to you, Dr. Salma. How active is this conversation in Nigeria at the moment? I get the sense that it's probably very active at the moment, given the COVID context and given the leadership role that Nigeria, to use Ayman's phrase, would like to be recognized in taking onwards.
Yeah. Thank you very much. And I fully align with Ayman's statement. Africa is not handicapped. And these are the discussions we are seeing. Nigeria is currently undergoing a transition of leadership. And the key takeaway from there, what we are emphasizing, is we need to have a change of leadership with more commitment to get things done by Nigerians for Nigerians. We don't need so much support, but we need technical assistance support. What has been done in other countries so that we don't waste time, we fast-tracked implementation. And what we are telling donors is to implement in high-impact interventions. We don't have to do everything. And we always say in Nigeria, there are good practices that have worked if we disaggregate the country into region. There are places that have almost, during the days of the MDG, not even SDGs, have attained as the MDGs of those days. So there are good lessons to learn, and it's all about repositioning our leadership to do the right thing and to commit and have sustainable commitment to the health and well-being of women and children, and to see the health and well-being of children as the gateway to sustainable development. And these are the discussions. And our security challenges are also tied, to the issues of the health and well-being of children, to the population explosion, to the inability of families to educate their children, and not just nutritional support, but to ensure that you have the number of children that you can take care of and ensure that you guarantee their future. So it's similar discussions that is going on in Nigeria.
Thank you, Dr. Salma. And I'm just going to come to you in 1 second with a follow-up there, Lauren. And James, I'm looking at you, whether you'd like to come in after Lauren with any reflections on any of this, particularly the comments on the solutions. But before that, over to you, Lauren. So how active is that conversation within DKT around manufacturing on the African continent where you're based?
Sure. I mean, we're starting to dip our toes into the manufacturing side of things. Our core focus is still the distribution and demand generation side of things. But I would echo what everyone has said. I mean, there is so much energy, there is so much business acumen in Africa already, in Kenya in particular. Small amounts of support can unlock so much of that potential. There's already a relatively robust manufacturing industry in Kenya for other types of medicines. And I've had discussions with some of the manufacturers in terms of asking if they would be interested in manufacturing hormonals or contraceptives. The challenge is the barriers to entry and not having the markets. And actually, in reality, that products can still sometimes come more cheaply from Indian manufacturers in other countries for a variety of reasons. I mean, you take condom manufacturing as well, the raw materials need to be relatively close by and accessible. And manufacturing hormonals and contraceptives requires a separate site as well. And so it's a significant investment where, from those conversations, they don't yet see the potential where they would have access to that market and be able to supply that market in either a more cost-effective, competitive way than the products that are already available, or without a serious investment, but something that could be looked at to support that moving forward.
It's a grand challenge. Thanks, Lauren. And James, I'm just going to bring you in here because we've got a couple of minutes left. we'd love to hear your reflections from the panel discussion from your great presentation earlier. Thanks, James.
And thank you for the opportunity, Martin. I think picking up on this point and on the question, I was reflecting that the global health community has worked on market shaping for many years and in fact has been congratulating itself for how good at market shaping it is as well. And I think the COVID experience and other experiences have taught us a lot, and I think it's important to reflect on that. I think it could be said that the market shaping that had been done was over-focused, for example, on narrow measures of efficiency, that sometimes it prioritized short-term perspective over longer-term perspective, and certainly to the question that priorities and decisions were driven from the top, reflecting donor perspectives rather than countries. And so SEMA's hoping to learn from that and aiming to do things differently. I think to give one example is in the way we look at markets and how we think about what a healthy market is, we're explicit that resilience is part of it, factors like supply security. And I would say that that enables us to pick up these sorts of dimensions like local manufacturing. But for us, resilience is wider. It's thinking about the financing side as well as the supply side. It's addressing the dependence on donors as well. So, I would recognize the question and make the point that, we're hoping to learn from those lessons and bring this new transformative approach to market shaping, bringing the best, but learning the lessons as well.
Thanks very much indeed, James. So I hope over the last hour and a quarter, you've had an enlightening insight into a country-led future vision of SRH product ecosystem where countries have that capability to drive national financing, procurement and supply planning informed by those consumer needs and preferences that Dr. Salma brought us back to several times in her comments. And we all know it's going to take partnership. We know it's going to take creative thinking. We've got great creative thinkers and leaders on the stage here, and we really do look forward to this journey together. So with that, please do visit our colleagues at SEMA Reproductive Health at exhibit booth 104. Please do look to scan the QR code that you can see on the screen here for more information. And of course, it just remains for me to say thank you so much to James, our presenter, to Lauren, to Salma, and to Ayman. And thank you so much to you all, and have a great rest of your afternoon.